lost in the rabbit hole. Connect every emotion, experience, adventure, struggle, pain, and achievement. Know the past, feel the future, and live this moment with Nisha Haraale. Every Sunday on Niche Radio.
Hi everyone, and thank you for tuning in to our 15th episode of Let's Get Lost in the Rabbit Hole with me, Nisha Haraale, on Niche Radio. And in conversation with me today is Dr. Shishir Shetty, Professor and Head of the Department of Oncology and Apollo Cancer Center, Navi Mumbai. Hi, Dr. Shishir Shetty. Are you all set to get lost in the rabbit hole?
Yes. Thanks for the invite, Nisha.
Did you always wanted to become a doctor?
So, generally, if you see, none of my relatives, except one of my uncle, was a doctor. We are Shettys, we come from a business family with restaurants and hotels. Shettys are known for restaurants and Udupi restaurants in Mumbai. In fact, now if you see the second and third generation Shettys, a lot of them are doctors. It's not that I always wanted to become a doctor. It's a choice that was taken voluntarily. That, yes, it's a high time that we did something for the society.
Where were you born and raised?
Born in Mumbai, raised in Mumbai, settled in Mumbai. Everything is Mumbai for me.
So you're total Amchi Mumbaikar.
Absolutely.
Where did you study?
If you look at my journey, I was born in Ghatkopar, but we shifted to Juhu. And from the fourth standard onwards, I was raised, born, married, everything in Juhu. And that's how it is. I studied in Mumbai, medical college in Mumbai. For a brief time, I went my post-graduation to a government college in Karnataka. But then I was back in Sion Hospital and then Tata Memorial for my cancer education. Yeah.
Where do you operate from now?
Since the last, so many, say 15 years or so, I'm based in Apollo Hospital, Navi Mumbai. I travel quite a bit, but last 6 months has been quite relaxing for me.
Doctors are all about school and boring life. Is that true? Or do you also engage yourself in music, art, dancing, boys' toys like cars and bikes?
So I think the world is so judgmental. So if you see a doctor who goes to a rock show or playing a guitar, I don't think any of the patients would like to get treated by them. It's quite fixed in people's mind that a doctor is probably, senior looking, balding, white hairs, very, 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 straight, very serious, grim, won't laugh, smile much, friendly. There are certain stereotypes of a doctor. I have been a swimmer all my life. And last 8 years, I've been a marathon runner. And, apart from that, hiking and traveling are predominant hit list on my this thing. So I never miss an opportunity to travel. Never miss an opportunity to climb the nearest mountain. I'm very unfortunate that I cannot play any instrument, but I love listening to all types of music.
Are you a very practical person, or do you also follow spirituality?
Spirituality is one topic where I can talk to you for hours and hours. So I do not confuse religion and spirituality. These are two different things. Spirituality is a part, I think, that we grow up and our beliefs and things that we do. I feel that every one of us is spiritual. I'm not talking about religion. Please don't confuse me here. Being a doctor and being in the field where I treat cancer patients, I think even if you are not spiritual, you become one. Because you see a lot of fear, you see death, you see sorrow, you see. If you can bring a small smile to them, you can do so many wonders. I think these are the things which actually automatically make you into a spiritual person.
Talking about the fact that you're being surrounded with all of these emotions, how
Yeah.
did you manage to keep your sanity intact?
Throughout the medical education and seniors and juniors and surrounding, everybody tells us that you should remain disconnected from the patient. If you are not disconnected, you carry the trauma. But believe me, disconnected from the patient is one of the most difficult things that you can do. Because when a patient comes up to you, when a person comes to you seeking help and submits themselves to you, it is a different level of trust and trust that we share, the bonding that we share. And there are so many great expectations from a doctor that sometimes, yes, it does affect you. We try not to, but it takes its toll.
Speaking about cancer and the fact that, we are in this month of awareness, spreading
Yes.
the message of cancer, I want to know some basic, things from you about cancers, which will help our listeners. To begin with, just in general, what is cancer and how does one know that they have it?
Okay, so let me put it in a very simple form that cancer, there are a lot of different types of cancers in the body, but broadly, we divide it into solid tumors. It means any tumors from the brain, breast, lung, abdomen, stomach, colon, bone, all this comes under solid tumors.
Mm-hmm.
And there is another set of tumors which we call leukemias and lymphomas and lymph node related cancer. So these are two different distinctions. Now, why a cancer happens, we know quite a lot of reasons as to why it happens. But the problem that happens is unrestricted growth of cells. The October month is special because, we devote our time and energy to spread awareness about breast cancer. And breast cancer is one of the topmost cancers in our country and abroad. And a lot of research and education and treatment is focused around breast cancers.
How does one get to know it?
Nisha, what happens is when you look at a woman from the age of 15 years to say 60 or 70 years, the breast which is there undergoes a lot of changes in these many years. Right from when the first period starts till, still 70 years after the periods have stopped. The breast undergoes a lot of changes. So these changes which occurs is essentially hormone related and influence of other things like your habits, your lifestyle, your general body weight, obesity. These are the few things which influence the breast in a very big manner. So when these changes occur, if you notice, a lot of people have lumps in their breast, which is very, very common. And 80 to 90% of the lumps are not cancerous. So this is one of the most common things. So the first thing that we teach, if we want everybody to learn, is about self-breast examination, which every woman should do once a month for 10 to 15 minutes. It is to check her own breast. Because we feel that if we educate a woman, she will be able to understand her breast much better than a doctor. Because every breast, every woman is different. So the touch, the feel, the feeling of lump would be first detected by the person themselves. So if you search the internet, there are a lot of tutorials on YouTube for self-breast examination, and they are very, very self-explanatory. I wish I can spread this message, and I'm using your radio to spread this message out about self-breast examination. Apart from that, the lady realizing that there is a lump, we over the age of 45, we generally ask every person, every lady to get a mammography done. Now, this mammographies will identify breast cancer before the lump is formed. It will detect very, very early. And like all cancers, if you are able to detect the breast lump or breast cancer early, the cure rates are up to 100%. The whole focus is on early diagnosis of breast cancer.
All these process, somewhere the person is emotionally hit. What are the implications and how can one help?
Let me put it, there is a lot of awareness of breast cancer in our country, which is increasing. Whenever a lady, especially in the age group of 45-50, detects a breast lump, there are 2-3 things which can happen. First is she is scared and she would immediately rush to a doctor to get it examined to confirm whether there is cancer or no. The second thing that can happen is ignorance, thinking that God will take care of everything. The third is something which is more dangerous and more common in our country, which is they hide it. They do not want to show to a doctor. They will not reveal it to their kids. They will not take friends, and they will keep it.
I think a fear of acceptance, maybe.
They will not even go to a doctor to get it tested, thinking that what will happen to me if there is cancer. Whenever a lady, this is one of the most common cause as to why we see breast lumps not at 1 centimeter, at 2 centimeters. The common size that we see in our country is 4 to 5 centimeters. So this is one of the main problems. And sometimes I think it is not only because of lack of awareness. There might be problems regarding financial implications, but most of the time, many of them are really shy and they don't want to trouble other people around them to take treatment.
Out of, say, 100%, I'm sure there's 80% recovery of cancer if it's treated at the right time.
So look, we talk about cure in breast cancer. We talk about cure. But cure only if it is detected early. Over the last 20 years, we've been treating cancers. We have so many survivors. And the reason we have so many survivors is that we've got good quality treatment available in our country, which is equal to the West. In fact, I feel sometimes the personal attention that is given in our country is much more than other places.
Talking about financial situation, cancer basically involves a lot of finances. And blessed are the ones who have insurance, and not so blessed the ones who don't. The ones who don't, how can they be helped?
Okay, so if you look at the actual statistics, 70% of our population is not insured. All right, so if a person is not insured, then they are going to have trouble taking treatment. But we've got a lot of government schemes. If you're below the poverty line, you can approach any of the centers where there are a lot of schemes, whether it is state scheme, national schemes, which will help you take treatment for free. There are charitable hospitals. So I work in a corporate as well as a charitable hospital. So we have wide variety of patients. So whether you want, one of these suite classrooms where all our top and rich people come, or maybe a laborer can come. So we got a variety of this, but treatment does not change. Treatment is the same.
What are the treatment options?
Okay, so ages ago, when breast cancer in the 70s and 80s, when we talk about, in fact, in the 90s also. So when we talk about breast cancer, the age-old treatment was removal of the complete breast. Right? So there was very few other treatments, very few limited medicines and radiation. Even in stage 1, in say 1970s, even in stage 1, the treatment or the cure rate was 70%. When I sit in 2020, I say that in stage 1, I'm nearing 100%. So what difference that has taken over the years? The difference is in our understanding of the breast cancer, understanding of the tumor biology, trying to give personalized treatment. Because of this, we come to know that there are various factors which is responsible. So treatment is obviously there is surgery, which can be a breast conservative surgery. But we've got very good medicines. We've got very good targeted drugs. We got radiation. So when a combination of all this is used for cure and treatment of breast cancer.
Let's talk about the brow myths and the implants.
My grandmother, who had asked me this question many years back when I was a young medical student, she straight away told me that, actually nowadays a lot of people wear bras and that is why the breast cancer has increased. And I just looked at her and I just couldn't understand that moment. And over the time I realized that what has actually changed is that the wearing of bra is one of the first thing about urbanization which has taken place in our country. So the urbanization of the women leads to urbanization of diet, lifestyle, everything. Breast cancer was not high in our country, but now it has become very high. The number of implants which are used in India is very less. I would say that, I will tell you why it is less. It is obvious that less than 2% of our population will ever even think of having an implant. All right. Most of plant studies which have come, they are all from US and Europe. Ladies who are affording and who were cosmetically inclined to look better or whatever. So the previous generation implants had a lot of issues. They used to leak, they used to have problems, and they were associated with breast cancer. But the present generation silicone implants which are there are pretty safe.
Any sort of message or advice that you would want to share to the family members or friends who are around these patients?
So one of the main things that I want is no patient needs sympathy. Everyone needs empathy. Whenever anybody has breast cancer or this thing, I would advise their relatives not to advise. Take them to a good qualified doctor who would show them the correct path, rather than advising based on what they have heard from wherever and trying to teach some things, because I feel that you are causing more harm. So the best thing that relatives can do is empathize, try to find the best doctor in your area, go to them and trust them for their treatment. A patient who is undergoing treatment for breast cancer, everything flashes in front of their eye. Their family, she's got kids, responsibilities, everything flashes and she sees that life is going to end. Somebody has to tell her that she is going to be all right. It is going to be treatment. Treatment is tough, but it will liberate her. It will get her a better life. She'll be back fully functional and working. Somebody has to tell her. in India, we need a lot of support. We need counselors, psychologists, doctors, nurses to do all that. But yes, we need a good amount of support for all.
My last question speaks about legalization and decriminalization of cannabis and CBD oil, which I believe helps a lot of cancer patients, and people have been talking about its magical use. What do you have to say about it?
So in human nature is something very nice, If you tell people not to do something, they want to find ways of using it. People have been trying to use cannabis for a long time for various things, trying to find medical indication. So let me clear some air about this. So there are two or three drugs which is based out of marijuana compounds, which has been approved for medical use.
Even in India?
In India, it is still not available. Okay, first one is something known as THC. Okay, and both are THC. It's basically a synthetic cannabinoid, and it is usually used to prevent vomiting and nausea due to cancer chemotherapy. One. Okay. The second drug, which is a cannabinoid drug based out of cannabis, is essentially used for pain relief. This is the only two uses which are there. Now, if you see, for centuries, marijuana has been used as a herbal remedy. In fact, cannabis can actually be used to treat seizures. Sometimes the anxiety and paranoia can be counteracted. Drugs which has been used from something known as cannabis oil, which is also known as CBD, and from there the extracts have been taken. Tea and CBD are one of the most common things which are used in the medical industry.
Thank you so much. I cannot thank you enough. I have no words to express. Have a super, super day, Doc. Yeah. Thank you. Bye. Bye. And thank you to all our listeners for tuning in today. Do catch me again next Sunday at 10 a.m. Until then, take good care of yourselves, be aware, and spread the awareness on cancer. And enjoy this next track coming up from artists Nike and Valerie De Silva, and the track is called Diseased.
Hi, I'm Valerie De Silva, a singer-songwriter and a traveling artist. The song Diseased is very close to my heart and is dedicated to my mother, who was a cancer patient. This song is my philosophy on life, our choices, priorities, the necessity of mental healing, helplessness and anxiety. The end to it all is hope, faith, and the fight against time to finally reach a point to live a day of peace, happiness, and a dignified life. I dedicate this song to anyone who is ill at the moment. I wish you good health. I hope you enjoy my music and keep listening to Niche Radio.
It's such a shame to be left right here, staring at the wall. Who am I to blame? To be left right here, stranded on the floor, locked up inside, keys hanging from the ceiling. I'm tired. all cross through to face our destiny. It may be a case